how are you? My name's Clive and I'll be your dentist today. Just before we begin, I do just need to make sure that our patient database is up to date. So I'll just grab my keyboard and I'll just ask you a few questions. Okay, I'll just put it on my lap here so you don't see me go anywhere. Okay, so can I just confirm your first name, please? And your middle name, if any, and your surname. And can I get your date of birth, please? Yes, day, month, and year. Okay. And can I get the first line of your home address? Is that spelled? Yeah, okay. And your postcode. Thank you very much. And your telephone number. Thank you. And now, while we're here, I'll just ask you a few questions. You just have to answer yes or no, or with a numerical value, depending on what I ask. Okay? So, do you brush your teeth regularly? Yes, that's a pretty simple question. And how many times a day do you brush your teeth? Okay. Are you a smoker? And if so, how many cigarettes do you smoke a day? Okay. And how is your diet? Do you eat regular meals? 3 meals a day? Okay. And when was the last time you visited a dentist? Okay. And overall, how would you describe your oral hygiene? Okay, just let me... Okay, we've got you all booked in. So I'll put that to one side. And let's quickly talk about what we're going to be doing today. So as I said, my name's Clive, and today we'll be taking a thorough look at your teeth. Now, first of all, what I'll be doing is asking you to open wide, as we always do, and I'll be going through each and every one of your teeth individually to see how they are. Now, while I'm doing this, I'll just be evaluating the overall health and oral hygiene that is presented, as well as evaluating the risk of any tooth decay, root decay, or if there's any indication of gum or bone disease. Following this, we'll just take a quick look to see if you need any tooth restoration or any kind of replacement at all, and check your jaw for any problems, whether you have an overbite or if there's anything else that needs my attention. Following that, we will just remove any stains or deposits on your teeth. It's not a thorough clean, but I'll be using some of my tools just to get rid of any plaque build-ups, or just take a look to see if there's any food debris within or between your teeth. Whilst we're also doing this, I'll be talking to you about the best way to clean your teeth and if there are any techniques that you can use to improve upon how you currently clean them, as well as eventually assessing your need for any fluoride and any other diagnostic procedures that we might cross along the way. Does that sound all right? Good. Now, there should absolutely be no discomfort during any of this procedure. If there is, just let me know and we can stop straight away. Or we can just start again another day, okay? One thing I do have to mention before we begin is that my assistant is on holiday today, so I will be, with your permission, recording the audio of this session. And that's just so that I have a case note to put down later, rather than me writing everything down as we go along. Is that all right with you? Yes, it'll mainly be me just saying numbers and the names of teeth and what condition they're in, okay? Thank you very much. That's very kind of you. As we go along, because you'll have your mouth open for quite some time, we've got this little device here. What we do with this is if there's a build-up of saliva, we use it to vacuum out from inside your mouth. And the clever thing about this little device is, because when you have your mouth open for so long, what can often happen is your lips can get dry. So we can then use this device to rehydrate your lips very gently to ensure there's no cracks or cuts. Okay? So don't be surprised if I stop every so often. It just makes a very gentle little noise. but I don't want you to be alarmed, alright? Okay, I think that's about it. Just let me check I've got all my tools. Okay. Get them ready. Of course, they've all been sterilised, so there's no need to worry. And I know it can be a little bit intimidating going to see the dentist, because we do tend to get up close and personal, but it's all for the benefit of your oral health, and it's important to keep on top of it, because your oral health, of course, can affect a lot of your other bodily functions. Okay? Right, just let me pop some gloves on, and then we'll just take a quick look in your mouth. How's your week been so far anyway? Good? Excellent. Alright. Let's get these on. As usual, this isn't to protect me from you. This is, although I wash my hands regularly, this is simply to protect you from any infections or viruses that I might be carrying. Okay. Alright. So first of all, I'm going to take this little mirror, okay, and we're going to take a look in your mouth just to make sure that every tooth is okay. Now, as I said, my assistant's away, so I will be explaining every single action that I'm doing and telling you which tooth I'm specifically looking at. It's not so much for your information, it is for my absent assistant, so that he can take down the notes later on. Okay? Right. So, if you could give me a big open wide mouth, please. Thank you. Okay. Now, as I said, this shouldn't be uncomfortable at all, but do let me know if it feels uncomfortable in any way. Okay? So we're going to start with your right hand side on the maxillary section of your teeth. Okay? And I'm going to work my way around, all around that section, and then we'll go to the lower one. Alright? So here we go. Keep your mouth open wide. Thank you. Okay, so we're starting off with the third molar, which is number 1. Okay? So keep your mouth open if you can. And then it's again straight on to the second molar, number 2. And this is the right hand molar, of course. And on to your first molar, number 3. Okay. And around, keep your mouth open. The second bicuspid, which, as you guessed, is number 4. It's fine. And your cuspid, number 6, is also fine. Now along to your lateral incisor, which is number 7. That's fine. And your central incisor, which is number 8. Okay, just very quickly, I've got a little bit of a build-up. I'm just going to remove some of the excess saliva from your mouth, so bear with me. Okay, excellent. And apply some to your lips. Okay, good. Oops. Excuse me. Pick that up, butterfingers. Okay. and straight back in, so open wide. Thank you. Okay, and now we're looking at the left central incisor number 9. That's good. Lateral incisor number 10, a little bit of plaque build-up, but we'll be doing a clean of the general vicinity anyway later. The left cuspid number 11, and the first bicuspid number 12. Okay, second bicuspid, your first molar, your left hand side nose number 14, and your second molar 15, and your third molar 16. All looks fine. Right, if you just close your mouth for a second, that's it. Lick your lips if you want. I understand that it can be a little bit arid when you keep your mouth open for so long. So I'm quite happy with the upper teeth. There's a little bit of plaque build up, but we will take a look at that when we get to the basically the removing of any stains or deposits. Okay. Just quickly before we carry on, in terms of your brushing technique, one thing I would recommend, and you may already do it, but whether or not you do or not doesn't matter, it's a good technique, is to not just brush your teeth, certainly not in a lateral motion like that, but also brush your gums as well to keep them fresh and to push away any chance of gum disease. Yes, I appreciate I don't have the best teeth in the world myself, but there is that old adage that you should go to the dentist with the worst teeth, because that means that every other dentist goes to him or her. All right, anyway, let's get on with the lower mandible. And so this way around this time. If you just open your mouth nice and wide for me, thank you. And we'll start on the right hand side again with the third molar on the right, which is number 32, so we're going backwards this time. And to the second molar, number 31, first molar, 30, 29, 28, and to the right cuspid, number 27, and your lateral incisor, very good lateral incisor here, number 2 on the palmar, number 26, central incisor number 25, 24, 23, your left cuspid number 22, your first left bicuspid number 21. Just give it some of that excess saliva. Okay, ready? Okay, and rehydrate your lips. All right. Okay. Okay, number 20. So keep your mouth nice and thank you. The second bicuspid, number 20. The first molar, number 19 on your left. The second molar, number 18. And finally, your left third molar, number 17. Okay, lovely. Thank you very much. Well, I must say that your teeth are all looking pretty top-notch, to be honest. There's not a lot of work to do, but what we will do is give you a general clean of some of my instruments to ensure that they are as clean as possible before using that device I showed you before, to give it a general rinse out, and then you'll be all ready to go. Alright? Okay, so what we're going to do then, I'll take a couple of my different tools. So what we've got here, I know it looks a bit piratical in a way, but it's used to remove plaque. And similarly with this one, which we'll also be using, is used to scrape plaque. With this one we can get in between the teeth and remove any debris that might be there. Alright? And with this one it's a much broader strokes. Okay? Now sometimes this can be a little bit uncomfortable, So if you do experience any discomfort, let me know and we can just stop there for a little bit, take a break, or just reschedule. Okay? Right, okay. Now I'm going to ask you to open your mouth again. I know. It never ends, does it? Okay. So that's it. Keep it lovely and open. I'll tell you which tooth I'm working on when I get there. So first we're going to start off down on the lower mandible and just the back around the molar area. Okay? Are you ready? How's that? Is that alright? Okay, moving around to your second molar. I'm just going to quickly switch tools. Alright, just get rid of a bit of that excess saliva. And rehydrate the lips. Okay, good. Thank you. We'll get right back in there. Just there was a little bit on your right cuspid, number 27. So I'll go back there. Down here. Okay, open wide. Oh, sorry. And across to your lateral incisor on the left hand side, number 23. Just switch tools. Open wide, thank you. Good, that's looking wonderful. Good, that's clean. Okay, let's switch back to, let's go to the second bicuspid, number 20, on your left hand lower quadrant. Okay, ready? Open wide. Okay, brilliant. Let's take it very clean. Just get rid of some of the excess saliva. Perfect. And rehydrate the lips. All right. How are you doing? You okay? Good. Okay, last one on the lower mandible. And that's just your third molar right at the back. Okay? Which is, yes, number 17. Right at the back, so open wide. Okay, thank you. Okay. Brilliant. Okay. Just let me get rid of that excess saliva and then you can... Oh, yep. Okay. Okay, if you just close your mouth and lick your lips for a second? Regain some of that hydration. Sorry. Okay, how are you feeling? Well, I'm very pleased with how it's going so far. I don't see any symptoms of gum disease. Usually when we see gum disease, what we'll be looking for is, well, the gum line receding, for one thing, and also an overly pink quality to the gums, or white, flashes of white, which can be an indication of inflammation or gum disease. But I'm pleased to say like none of your teeth or your gums exhibit that at the moment. Your jaw positioning seems good. We've got a good alignment between the upper and lower mandibles, the maxillary and the mandibular. Okay? I've got an overbite myself, which is absolutely fine. It doesn't matter, it doesn't affect anything. It just means that my front teeth come down over my bottom teeth, which is, yeah, just means that I can whistle really well. Okay, so if you don't mind, let's dive straight back in, and what we'll do now is we will take a look at the maxillary, the upper jaw, and all the teeth there. I just want to take a look at a few and clean them up a bit, alright? Okay, so if you open wide for me again, thank you. And we're going to go straight in up, okay? So we're going to start off with your first molar on your right hand side of your upper jaw, okay? Ready? Thank you. Okay, good. And straight onto your cuspid, which is number 6, by the way. Switch tools. Keep your mouth open, thank you. Okay, just remove some of the excess saliva and drop some of my tools in the process. Okay, here we go. Rehydrate the lips. Perfect. Dive back in. Okay, so up to your central incisor now on the number 8, so on the right hand side still, okay? Thank you. Open wide. Perfect, thank you. When you brush your teeth, do it laterally, like that, yes? And also be sure, because what you can do, sometimes the central incisors and also the lateral incisors can be a bit more pronounced than the cuspids. Okay, you can close your mouth. It can be a bit more pronounced than the cuspids. And so what you can do is when you laterally brush your teeth, you can miss some when you brush the front. Okay, so what I want you to do is press down a little bit harder with your toothbrush. Okay, and just ensure that you're cleaning all of the teeth when you laterally brush the front, okay? Right, open wide. Yeah, yeah, that's fine, thank you. Straight back in, onto the central incisors. Okay, brilliant. Perfect. Okay, down along the line to the lateral incisor, number 10 on the left hand side. Beautiful. Just get rid of some of the excess saliva. Keep your mouth open. Look at the lips. Okay. And moving across to the first bicuspid on the left hand side, so number 12. Okay. and along to the third molar at the back of the upper maxillary left-hand quadrant. Okay, number 16. Alright, and that's your lot for the cleaning. What I'll do now, very quickly, let's go through each tooth again, super fast, so I won't need to use any of the saliva removing device or anything like that, okay? And then we'll give you a little bit of a clean, a bit of a blow dry, alright? Okay, so you just open your mouth one more time, and I'll try to be as quick as possible. Okay. So for number 1, number 1 is clean and healthy. Number 2, clean and healthy. Number 3, clean and healthy. Number 4, clean and healthy. Number 5, your first bicuspid clean and healthy. Number 6, your cuspid clean and healthy. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, and finally 32, your third molar. Brilliant. Thank you very much. You can close your mouth for now. Okay, and very quickly, we'll just give you a bit of a hygiene spray. I don't think we'll use any fluoride today, okay? I don't think there's any need, and I think your cleaning technique's good enough, so we don't need to go through any alternative methods. I don't think there's any other diagnostics, and you certainly don't need any of your teeth replaced at this time. So we'll just give you a bit of a hygienist whiz, and then I can send you on your way happy chappy. Okay, so open your mouth very briefly, and here we go. And there we go, perfect. Okay, just let me type up a few notes. And just very quickly, before you go, we do like to collect feedback on our sessions. So if you wouldn't mind just answering on a scale of 1 to 10 the following questions, 10 being good, 0 being, well, 1 being bad. Okay. How satisfied are you with your appointment today? Would you come again? How relaxing was your dental practitioner? Do you feel that you were well informed and all of your questions were answered? Thank you. That's great. It's just something we have to do for admin. I think it's a bit silly myself, but thank you ever so much for taking the time to take part. Now, all I can say is continue to look after your teeth as you have been doing. And what we can do is, if you speak to Joe on reception, he can book another appointment for you later in the year, or in a few months, or whenever. Okay, but until then, keep your teeth clean and stay out of trouble. Okay, all right, bye bye.